practical, an advanced registered nurse practitioner is $109,000 to $154,000 a year. And the interesting thing is that the fun fact you'll see down at the bottom is 50% of the nursing jobs are in acute care, that's hospital settings. It's a variety of settings. There's schools and clinics and outpatient and ambulatory care, home health care, community health centers, the military. A friend of mine has traveled the world as a nurse. She's been all over the world, met her husband in Dubai. So that's been a very exciting thing to see that actually in practice. So you may want to write this down if you want to be a nurse. Our website is www.wcnursing.org, O-R-G. That's www.wcnursing.org. And lots of information, and most of the information we're going to give you today is going to be there on their website. So the different nursing degrees. The first one is the licensed practical nurse, and this is a 2-year degree. Several community colleges in the area have that. It's probably the lowest level of nursing that you can be involved in, and most of them are in home health care at the moment. Then the next level up is registered nurse, and this breaks out into 2 different forms. There's the RN, which can be done at a community college and is a 2-year degree, or there's the BSN, that's a Bachelor's of Science in Nursing, and you are an RN, but it's a 4-year degree, and usually it's at a university setting. A lot of hospitals are looking for more BSNs than RNs, so it's something to consider when you're making your choices. And then there's the advanced practical registered nurse. Now this is a higher degree, and it's going to take a lot more schooling. You actually get a doctorate in nursing, and it also gives you the right to administer drugs. You can run the clinic by yourself. Really, a lot of nurse practitioners in especially rural communities will be like the doctor in the clinic. They will just be that. And then there's other thing you can become as a nurse educator. Usually this requires a master's degree, but it's about training the future of nurses, and it's a great career. So nursing specialties, just see some of these in here. Again, military nurse, a flight nurse, a lactation consultant, a pediatric nurse, a certified nurse midwife, an independent nurse contractor. There's people, the contractors can travel the country, and they just, where the need is, they go. You might have heard a lot of that during the COVID crisis that we're hopefully at the end of, or towards the end of, that a lot of nurses that were contractors went from place to place wherever the need was the greatest. And then this is called the 10 steps to becoming a nurse. So first you would start with finding a nursing program that you're interested in. Again, you'd want to choose, do you want to be an LPN? Do you want to be an RN? What would you like to do? Then you probably want to meet with your advisors at your school, your counselors, and talk about what would be your next steps. Where's the college that's right for you? What would the prerequisites be? So you'd apply for admission to a school, and you would complete your prerequisites. A lot of that's our science classes, your biology, your anatomy, all the things you're going to need to know, and a lot of math. There's a lot of math in nursing. Then once you receive your admissions decision, and then you move on to completing your financial aid if you need that. Then you attend the nursing school. And once you've been there for a couple of years, you'll start doing your clinical rotations. It's actually getting out into the field and dealing with patients, practical experience that you'll need to be a nurse. And then you'll apply for your state licensure and pass your NCLEX. That's your national recognition of being a licensed nurse. And then you're out in the field and becoming a real nurse. Again, on our website, we have this document, which is the approved nursing programs in the state of Washington. And this list is all of the schools that are approved by the state of Washington, in the state of Washington, to becoming a nurse. And it's a great document. You'll want to get a copy of that if you get a chance. And the other thing we have on our website is a lot of the scholarships and loan programs that are out there to become a nurse. And again, that's on our website. It's a really good program. And there's also a lot of videos we have on our website for you to take a look about becoming a nurse and what it is to work in certain fields. It's a lot of good information. Okay, we're getting some. Would you recommend students study at a community college for their prerequisites and transfer? That's a great way to do it. So it's not as expensive. A lot of people do that for most degrees, actually. A lot of people can do that. Go to your community college for your first 2 years. Now, the nice thing about nursing is you can also get your degree at a 2-year community college. That's the RN. If you want to do a 4-year degree, you could do your prerequisites at your community college and then transfer to a 4-year school and get your Bachelor's of Science in Nursing degree. And how many years does it take to be a nurse? It can be as short as 2 years. I don't know. Some people take a little longer to do it. And again, a Bachelor's of Science probably takes about 4 years. Any other questions there? How many years does it take to be an advanced or a practical nurse? Okay, that takes a few more years. So what you would be is you would have to get a Bachelor's of Science in Nursing. Then you would go on to get your doctorate degree. I think you actually skip master's when you do that. You can go to, it's called a DNP program. And I believe that's another 2 years on top of the 4 years. So it's a good 6 years that you'll, it's not quite as long as a doctor, but it's another couple of years. How do you know if nursing is the right career for you? The great thing about a lot of programs in the area, and one of them that the University of Washington has is called a nurse camp. I think they've got another name for it now because it's virtual. And we can get you that information, but you can give it a shot and learn a lot more about how nurses deal with patients and what the career is like. Because sometimes, to be honest, it's not the career for you, but it's a great way to find out what it really takes to be a nurse and decide whether that's something that's right for you or not.
I'd also recommend. Oh, can I? I would also recommend reaching out to where you receive your care, and try to find nurses that you can ask questions to, and ask them what they enjoy about their job and what they think is difficult about their job. There are so many specialties and so many environments for nurses to work in. It depends on what your interests are, but chances are there's probably some place in nursing where you would be fulfilled and happy. It's not always at the bedside, but a lot of the nurses I do talk to do love working at the bedside and working with direct care with patients. So, just keep exploring, keep asking questions, and definitely, yes, Frank has a great point. Look for some of those nursing camps or opportunities to learn more about what nurses do on a daily basis.
So another question is, what programs do you recommend for a current high school student aspiring to become an RN? I would say your math classes. Take your math classes now, get them out of the way. And I know I was not a great math student, so I understand, but you really are going to need those. So that would be the first thing I would talk: math, biology, get those out of the way. And can you get a job with the associates, or do you need to continue with your education? You can definitely get a job with your associate's degree. And at RN, yes, you can actually practice, and that's fine. What you'll find is that there's a lot of programs about, once you've been practicing for a few years, you can translate that plus a little more education into your BSN, and that's called an RN to BSN program. And there's a lot of those out there. And like I said, there are some hospitals now that are requiring a BSN for all nurses. So it's something to think about when you're out there choosing what you want to do. Let's see. We will find more information for you on nurse camps. If you want to, I don't know how they do that, Brenda, to leave their email address or how they want to do that, we can get you that information.
Yeah. Yes, please put your email address in the chat box, or if you want to do it more privately, this is up to you. You can email myself at brendal@wcnursing.com, or if you're on our website and you didn't remember that email, we have a box at we have an email, info@wcnursing.org. I'm sorry, and go ahead and put your question right in there, or let us know that you want to know about nurse camps in the area, when and where they're happening, and we'll get you that information for sure.
So would you consider nursing to be competitive? It can be a little bit, mostly in the cities, but there's always a job for a nurse in the community. It's going to be surprising, but there always is an opening somewhere within your community, whether it's a hospital at the north end of Seattle or, something down in Kent, for instance. That might be if you're staying around the area. There's always a position around, so you'll be surprised. I'm interested in neuroscience and nursing. Is there a career that involves both? Actually, some nurses specialize. So yes, that is possible. So once you get your degree and you're working more for your clinicals and you're getting out there and getting some experience, you can start looking into the actual specialties out there. Like we were looking at that one page, you can be a nurse midwife, you can be all the kind of different nurses. So yes, like there's a surgical nurse, they just do surgery, so all those are available to you. Any other questions out there? I think we answered all of them.
I have a question on mine. So apparently we don't have the same chat box because I'm not seeing those questions.
Oh, that's interesting.
So you are doing a great job. But I have for NPs, and what are the responsibilities? So ARNPs, NPs, what are the responsibilities of a nurse practitioner?
A nurse practitioner and it's an advanced degree. You're basically, you've gotten a doctorate, and the biggest thing is that you were able to prescribe medication. And that's why a lot of nurse practitioners are able to practice without a physician on site, for instance. That's why I was talking about, especially in some rural communities, a nurse practitioner is the head doctor at that site because they are able to do those skills that doctors do, but it's kind of this in-between land between a nurse and a doctor. I know it sounds a little funky, but that's the best way to describe it. Was there something else, Brenda?
Yeah, well, to expand on that a little bit, advanced, there's like different specialties of it, nurse practitioners. So nurse midwives are nurse practitioners, anesthesiologists, nurse anesthesiologists. I always have
anesthesiologists.
Thank you. They are a nurse practitioner, or they have an advanced nursing degree. And then family practice nurse practitioners that can have their own, they can be your primary care provider, they can be your family doctor. And so after you finish your additional school, sometimes you do have to take additional courses in the specialty that you are wanting to go into. So if you wanted to be a nurse midwife, for example, you would go on to take some courses focusing on infant care, delivering babies, and nurse midwives actually are the care of women from birth through death. So it's quite a wonderful growing field, and we see a lot of interest in that right now.
When you learn that you want to specialize in something, there's a lot of certificate programs you can go into, and that will help you. How do you become a traveling nurse? Well, first you have to become a nurse. And then once you've usually had a little bit of experience, you can choose to travel. And there are agencies that specialize in sending traveling nurses out to different places. So let's say somebody in Minneapolis needs some nurses. They will go through their registry and contact people. Who wants to go to Minneapolis for a month? And off you go. Usually they have housing provided for you while you're there. And you're there for a short amount of time, depending on what that is. Just like some people do things like Medical Teams International. They go internationally all over the world, and that's more volunteer, but you can travel the world actually doing some of that. Is there an LBGYN nurse profession? Again, like Brenda was talking about, if you became a nurse midwife, you would be able to deliver babies. So yes, there is that. And you can also specialize nurses that just do the neonatal, for instance, and work in the hospital setting, or you could become a nurse midwife and actually deliver. And usually that's sometimes in home, sometimes in a clinic.
And now nurse midwives are connected with hospitals. So nurse midwives are great options for normal pregnancies. And so they may choose to give birth at a birthing center with a midwife, at home with a midwife. But if there are any difficulties or challenges, you are also connected with a hospital. So it's a growing field here.
Any other questions out there? Did
Is
I
it,
miss any?
oh, is it difficult to become a travel nurse? Maybe you got that one all right.
No, she was asking, how do you become one?
Oh, difficult, then there is another one. Is it
The
difficult?
more experience you have, the better chances you have of being a traveling nurse, because what they want is somebody who knows what they're doing. So you may want to be practicing somewhere for a year or two before you can become a traveling nurse, have that experience under your belt. That's really what they're looking for. I don't think many traveling nurses are first year nurses, but there are some. But again, you'd have to find an agency and check it out. Like I said, usually they're looking for a little more experience. Anything else out there? Did I miss anybody or anybody's question? And did anybody come into the room since we started the presentation? And do we need to do that again? Anybody? What about surgical nurses? Is there some career path expect you to specialize in that? Yes. Yes, there are career paths. Again, once you're doing your clinicals, you can kind of decide. Sometimes there are certificate programs, especially like the University of Washington. I know they do them, where you will specialize and you'll get your certificate, say, in surgery, and you would be a med surg nurse. So those are all possible. But that may take, like Brenda was talking about, a little bit more education when you have to specialize. You're welcome. Anybody else out there with a question? Am I missing anybody? I think I've got them all.
So we've had a couple, or I met some nursing students who also were able to do Head Start in high school. And so they were able to do some of their prerequisites, whether it was 1 year or 2
You're
years.
talking about Running Start.
I'm sorry, Running Start. Head Start. You're right. Head Start's the preschool program. So I'm sorry. Yes, Running Start. Running Start. And so they were able to complete their prerequisites while in high school, before they graduated high school. And if you can qualify for Running Start, those courses are free. So it's a great way to save some money and some time. So then you can jump right into a 2 or 4 year, or jump right into applying for a 2-year or 4-year nursing program. So just a thought if you are wanting to hit the ground running.
So the question is, would you recommend Running Start for upcoming juniors or skills centers? I would double check with your skills center at your school just to make sure what the requirements are for Running Start. I don't know if everybody knows what Running Start is, but it's a program for you to take college classes while still in high school. And again, like Brenda said, if you qualify, it is free in this state. So it's a real option for you to get some prerequisites, whatever career you decide to do, out of the way. But I would check with your counselor. I'm not sure of the specifics of Running Start. It says students can earn up to 14. Yeah. So yes, you can earn up to 14 credits. So I know I've worked with kids that were at Bellevue Community College, now Bellevue College, and did Running Start. But I think most of the ones that I personally worked with were seniors at the time. So I would check to make sure a junior could participate, but I think they can.
So another question, Frank, is there a list of those prerequisite classes that you need to take before getting into nursing? And that is a great question.
Yeah, I'm not sure if we got that on our website, but I do know that you can talk to your student counselor, and I believe they should have that somewhere for you. If not, you can always email us and we will make sure to get that list for you. We're going to have to look that up, aren't we, Brenda?
You know what? And I think that's a great question and something that would very much be great information to add to our website. So I'll go ahead and look into that information and try to get a document up on our website. I would go ahead and talk to your counselor first, because they probably do have that list, but I think that's a great question and great information to share. So we'll work on getting that on our website. Thank you. Okay.
Did you get another question?
Oh, no, it was just for the Skills Center. It says students can earn up to 14 allied health credits. I know that I've heard at some places you can get a, what is it, a CNA?
The That's a certified nursing assistant. And again, that's somebody who can do some home health care stuff, who can definitely work in a setting, but they're usually not doing as much as a nurse would. It's pretty basic care, helping people to the restroom and making sure that things are where they need to be in the hospital and that kind of thing. So it's a little bit different.
Yeah, CNA is different, and we don't have that much information on it because we work on licensed nursing career paths. However, that question at the beginning about how do you know if nursing is for you, the CNA program is generally a few months to get that, and then you can start looking for job opportunities and really get that hands-on experience to see if that's something that you enjoy doing and want to go on to get your RN, LPN, or ARNP license. So it's a good place to start.
Lots of nurses begin at the bottom and they work their way up. After practicing for a couple of years, they'll get to the next degree, and then practice for a couple of years and get to the next degree to make sure that they do want to move on and it's really right for them.
And a lot of nurses, they find a place where they love and where they really enjoy the work, and they might not, go on to that ARNP level. So there's all kinds of paths you can take in nursing. Other questions? How about a raise of hands? How many of you have had an experience with a nurse that has helped to inspire your interest in nursing?
Oh, there's one, there's two. Oh, look at, this is great, you guys. 3 hands, that's wonderful.
Good.
Yeah, the exciting thing is a nurse is really the person you're going to deal with, at least first, whenever you go into a hospital setting or even a doctor's appointment. You'll be dealing with a medical assistant or a certified nurse assistant or a nurse. So they're the people you're going to see first. That they're rated one of the most trusted professions in the United States.
For like 10 years in a row.
What do you like most and least? Well, I would say at the same time, it's patience. There's nothing better than helping a patient. There's nothing better than helping somebody feel better. There's nothing better than taking care of someone when they're at their lowest point. But also, sometimes patients can be a royal pain, and it's one of those things you have to deal with and learn to, accept some people, because again, you're seeing some of them at their lowest point, and they may not be the most pleasant people to be around. So sometimes that can be challenging.
And if you guys are interested in reading some stories about some relatively new nurses on our website, if you go to About Us and the newsletters, each newsletter has an article called Emerging Leaders in Nursing, and they're nurses with 1, 2, or 3 years, give or take, into their career. So they share their journey and why they chose nursing, some of the obstacles they faced along the way. They give some advice for people who are interested in entering into nursing, and they're really inspiring, really great to learn more about nurses' actual experience as they enter into the field.
So here's a question for you, Brenda. What did you want to be when you were in high school?
Oh, that's a great question. It took me a while to figure out who I was. And it wasn't until after high school that I learned a lot about myself, that I really enjoyed reading and writing. I did not enjoy it that much in high school. After high school, I really developed that passion and that interest. So, and I was a preschool teacher for 9 years after school, but then really developed my interesting communication. So it took me a good while to find my passion. And so I applaud and just that you guys have an interest, that, the students in this room know what you're interested at least learning more about. I think you're 10 steps ahead of probably where I was when I was in high school. So, but I did get there eventually, and I love where I am now. So, how about you, Frank?
I think my path was very similar. I did a lot of different things before I got into healthcare. I was an industrial optics technician in California. And then when I came up here, I did a lot of different things. I actually taught computers for the state legislature before I ended up at the Northwest AIDS Foundation, which is now the Lifelong AIDS Alliance. And I ended up working with them, and that led me into a healthcare career. And I've worked with several different agencies since then. And now I'm working for the Washington Center for Nursing. But it took a while to get there, but I was very happy I did.
Mm-hmm. Yeah, I think it's important to just keep going. Just don't give up and don't let anybody stop you. Although we can have good days and bad days and discouraging days. I think making sure that you fulfill your full potential is part of growing up, part of entering into adulthood, and finding satisfaction in your job.
Exactly.
Any other
Anything else?
questions? And if you guys want to unmute and say something too, that's fine.
Well, you guys have had great questions so far. I want to thank you so much. I wasn't sure what today would be like, but this has been great.
Yeah.
Any college advice you have? Any college advice you have?
Well, there are a lot of different colleges. Oh, go ahead, Frank. I'll stop.
Yeah, good. No, I was going to say the same thing. There's a lot of different colleges. I think it's about what experience you want to have, and sometimes you may change midstream and you may do different things. But there's community colleges if you want to get your feet wet. There's community and technical colleges. There's four-year colleges. There's colleges in your community, and there's colleges across the country. It's about kind of what your experience you want to have. And it's about choosing what's right for you. What are your strengths and weaknesses? My strengths and weaknesses, or being a nurse's strengths and weaknesses?
Can I add something to the college?
Sure.
Sure. Sorry. I really want to. Universities are great and they're wonderful. But I also, sometimes there's a lot of private colleges out there. However, I really want to advocate for community colleges. Their courses and their costs are really student-centered, and they can often offer a great experience and a great way to start to pave that track. And of course, universities too, if you go directly to a four-year, that's great as well. But I think that your local community college is also a great resource, even if you just schedule an appointment with them and start to, with their counselors and start to learn more about what they offer and what they need from you is a great place to start. All right, Frank, sorry, thanks.
No, fine. So now a question about, should current high school students, I'm sure that's start for both junior and senior year, would it be beneficial to them in a nursing career for the future? I would say you can certainly hit the ground running. You certainly could find out whether, you can get through the math and the other sciences that you'll have to get through as your prerequisites to find out, even if, then this is all before you would even remotely see a patient. So it would give you at least a feel for it. Like I said, I'm a horrible math person, but you kind of have to struggle through it and get through it to be able to do what you would like to do. And it was for me, that's personally, but like I said, it might be a great way to get your feet wet. Just like Brenda was saying, to become a certified nursing assistant, that might be a great way to get your feet wet. You can do it pretty quickly. You can be making a little money and be out in the field and see what it's like out there in a clinical setting and see if that's what's right for you without having to spend, say, 4 years doing it. That's another option. There's all kinds of options to this. What you wished you did when you were in high school. I don't know. I think I did everything I wished I wanted to do when I was in high school, which is probably why it took me so long to get started. Brenda, I don't know. Do you have anything to offer about the running start or what you wished when you were in high school?
Yeah, I mean, I just didn't take advantage of all the resources that were out there. I just don't think that I knew how valuable counselors and how many resources were available through my high school. And I really think that slowed my track down. And if I could go back, I would go explore those resources a lot more because as far as helping to apply for scholarships, helping to apply for college, helping to get letters of recommendation, helping to hear other people's experiences, and just preparing me for entering into college. So I think there's a lot of opportunity to prepare you for that next phase in your life in your high school. But for some reason, I just really didn't know about them. So yeah, that's what I would say.
Frank, do you remember what the highest level of math you needed to take in order to enter the
I
program?
don't, not off the top of my head because I blocked it all out because it was math.
Yeah.
But
Understood.
I do know that if you were thinking about it and you want to look this stuff up, and like I said, we can get you this information. But it's important to do that because I grew up in Southern California, and because of that, we were all kind of directed towards the state school system, college system. So honestly, the least math I had to take was what I took in high school so I could get into a state school. And lo and behold, that wasn't nearly enough, as I found out later on. So now that you are at least looking at this, it's a good time to look at what is required to become a nurse and what kind of math is required.
I would also say, I was really great at math and I was not good at writing. However, like I said, after high school, I got really into writing and reading. So if you're not good at math or you're feeling discouraged there, that has, you put in the work and you get through it and you will learn it. And there's lots, a lot of, you need to be a whole person to be a good nurse. And so don't be discouraged, get through the classes and don't let anything stop you, because you never know what you're going to find out about yourself along the way and what your incredible talents and skills are, and they'll grow as you grow too.
So